Okay. Okay, so we had rheumatoid arthritis. RA can be described as a chronic systemic inflammatory disease that is caused by a certain trigger that causes an autoimmune reaction, and then it causes chronic joint inflammation and hypertrophy of synovial joints because the body's immune system attacks the healthy cells in the body, which then causes the inflammation. It most commonly affects like the fingers, hands, knees, and wrists, and it can also affect other tissues like the lungs, heart, and eyes. Usually they feel chronic pain, patients with this condition, and possibly malformation. The exact etiology is unknown, but research shows that it may be caused by an abnormal response from the immune system. There have been a few genes that have been linked to RA, and those are listed there. Research and scientific evidence indicates that certain things have an impact on the cause of the disease, such as genes, hormones, environmental factors, obesity, emotional trauma, and bacteria or viruses. RA is the third most common arthritis behind osteoarthritis and gout. Approximately 1.3 million Americans are affected by RA. And women are 3 times more likely to develop this than men. And typically women start to develop RA sooner than men. And it can affect anybody between the ages of 30 and 60. There are many drug classifications and drugs that are used to treat the disease. A patient may be on multiple prescriptions of these things, but we chose to focus more on DMARDs, disease-modifying anti-rheumatic drugs. And do I decide? Okay. So DMARDs include immunosuppressive agents, immunodilators, and antimalarials. And due to the potential toxicity, treatment with these drugs are initiated by rheumatologists. Immunosuppressive agents treat refractory arthritis, which is arthritis that does not respond to anti-inflammatory drugs. Immunodilators treat moderate to severe RA by disrupting the inflammatory process and delaying the disease progression. Antimalarials may be used to treat RA when other methods of treatment fail. They are usually used in combination with NSAIDs and in patients whose arthritis is not under control.
So for our drug card, we chose the DMARDs, which are disease-modifying anti-rheumatic drugs, and some indications and contraindications. When using DMARDs, you use them when NSAIDs do not control immune-mediated arthritic disease sufficiently, and they're used in patients with RA, osteoarthritis, ankylosing spondylosis, psoriatic arthritis, severe psoriasis, Crohn's disease, and ulcerative colitis. Holy cow, that's a mouthful. They're contraindicated in patients that have active or latent TB, non-healing skin ulcers, and upper respiratory infections. The action of the DMARDs, they're an immunosuppressive that's used to slow down the disease process of rheumatoid arthritis on the joints. It reduces flare-ups and it can maintain remission. It's not a cure, but it's something used to treat the disease. Some interventions that a nurse should know is they should obtain a baseline and monitor vitals. They should monitor weight, monitor the patient for signs and symptoms of infection, and monitor laboratory results for signs of infection, blood dyscrasias, and renal and liver function tests because the medications do affect the liver. You also want to monitor the psychological status of the patient due to depression, self-esteem, and lifestyle changes. Some side effects, the most common were the GI disturbances, nausea, vomiting, diarrhea. It's also really important to monitor the patient for the renal and liver toxicity because that can happen. Most of these medications aren't taken every day, so you have to monitor the patients to make sure that they're taking them properly. Infection is the number one. Another side effect that's a big one, anemia, alopecia, fatigue, mouth sores, and skin rash. And then we should educate our patient and let them know that these medications are usually taken lifelong. You need to take them as prescribed, and you want to refrain from alcohol use due to potential liver damage, and emphasize the importance of routine lab work for early detection of liver and renal damage. And you also want your patient to report any signs and symptoms of infection immediately. For our QSIN, we chose to do evidence-based practice, and the reason we chose this is because rheumatoid arthritis does not have a cure. It can only be treated. So we thought that it was extremely important to listen to the patient, how they were feeling, to use research that has evidence backing it up that is more current, and your own knowledge in order to properly take care of and help the patient to be in the best condition that they can be in. The effect of this drug on the disease process in the body. So DMARDs help alleviate the symptoms of rheumatoid arthritis, while the drug slows the progression of the disease in the body. Rheumatoid arthritis causes white blood cell overpopulation. So this medication will work against that and try to decrease the amount of white blood cells, and that can help the inflammation decrease. They inhibit on the T and B cells of the immune system, and normally these medications take 6 to 8 weeks to actually start to work. And the biggest effect on the body is the risk for infection, because it is working against those white blood cells to try to lower them. So it could end up creating an infection in the body. And then how the drug impacts the person's life. So there's a lot of different things that these medications do. Because the risk of infection, it can affect the patient, and they may not be able to go in large crowds, family gatherings, or social events. So that could kind of mess with their psychosocial aspect of things. Another side effect is hair loss. So that can cause an emotional hardship for the patient. And then another thing is patients who are on these medications, they're not required, but they're recommended to be vaccinated. And I know a lot of people don't like taking the influenza or pneumonia vaccine, HPV, shingles, any of those. They should be getting those, but it may make the patient kind of in a hard situation with an ethical dilemma if they should take them. Injections or not. Also, methotrexate, which is a DMARD, it cannot be taken while pregnant or trying to conceive by either the mom or dad. So if you have a younger patient who has rheumatoid arthritis and they're still wanting to have children, that might be something that they have to consider, and that also can have effect on them, and it can give them a hard time coping with the choice that they're making. It's either the medication or a child, so that's a hard one. And then the patient has to be monitored closely for lab work to check their liver and kidneys. So that can cause stress or financial hardship on the patient with constant trips to the doctor's office. And then the patient may need help taking the medications. For example, the methotrexate, it's only taken every couple of weeks. So it might be hard for the patient to remember when they last took it, how often they're supposed to take it, especially if you have an older patient who's taking several other medications. And we don't have any questions. I don't think anybody else does.
If not, email us or look in the book.
Yeah. And these are references and our questions. You guys can read these. I'll let Jamie tell us the answers because she did these.
Okay, so question number 1, which statement made by the patient indicates effective teaching regarding DMARDs? A, I can stop taking DMARDs 2 weeks after my symptoms improve. We obviously know that one's wrong. I will report a fever lasting longer than 72 hours, possibly. I can still drink alcohol on a regular basis. That's no. DMARDs are not pain medications. So we're in between B and D. Well, the correct answer is DMARDs are not pain medications. I know we emphasized on the importance of a fever and infections. You need to report that immediately. So you don't want your patient to wait more than 72 hours. You want them to report it as soon as they have a fever. And DMARDs are not pain medications. Eventually, they will reduce inflammation. So that might kind of help with pain. But again, it's not a pain medication. The doctor might prescribe pain meds while the medication is taking effect. Question number 2, a nurse is reviewing lab results for a patient with RA who is taking DMARDs. Which lab result requires immediate action? I'm just going to tell you it's white blood cell count because of infection. It is slightly elevated, but still that risk for infection is a big one with these medications. So you want to, get on that right away, either stop taking the med or start taking an antibiotic. 3, a nurse knows that the other indications for DMARDs include, this was on our first slide, it's ulcerative colitis and osteoarthritis. And that is it. Thank you. Watch it and freaking save.
Oh my God. Dude, those words trip me up.
I know.
I was like, where does it save to? What if it's still recording?
It probably is. How do I get out of here, Heidi?
I don't know. I've never done this before. We're not redoing this, so. How do
I get to it?
It is what it is, if you can still hear us. If you end it, well, it's